Anemia is described as having reduced amount of hemoglobin in the blood. Iron deficiency anemia is the commonest cause of anemia all over the world. Certain age groups are more prone to get iron deficiency anemias, especially preschool children and adolescents. The commonest cause of iron deficiency anemia in toddlers is prolonged breastfeeding, prolonged bottle feeding, delayed weaning or improper weaning. A diet deficient in iron as well as worm infestation in some children can further add to the problem of iron deficiency anemia. Children who suffer from iron deficiency anemia may be lethargic, irritable, they might not be able to concentrate into their schoolwork, the child may be pale, the child may have breathlessness, the child may have increase in heart rate and audible heartbeats which are known as palpitations. The child may complain of frequent leg pain and disturbed sleep. The following foods, if included into a child's diet, can not only prevent anemia but can also help in correction of anemia if it is present. These diets will also provide vitamin B12, which is a major factor in preventing megaloblastic anemia. Also, these diets will provide vitamin C, which is required for absorption of iron. First and foremost are vegetables. Green leafy vegetables like spinach have a very high iron content. Also, beetroot has a very high iron content. Tomatoes have a lot of vitamin C which will help in absorption of iron. All these vegetables can be incorporated into the child's diet in form of a sabzi or in form of a paratha. They can be put into khichadis, they can be made into soups. Second important component of a diet are nuts. These can be ground nuts, these can be pistachios, or they can be almonds. They all have a very high iron content and also the protein content in nuts is very high. Non-vegetarian diet, predominantly red meat, eggs and liver have a very high iron and a protein content, and they should be definitely incorporated into the child's diet if the culture permits it. Cereals like whole wheat chapatis, jowar, bajra again have a good iron content and they should form a major component of the child's diet. Jaggery can be used as a substitute for sugar. It can be put into various sabzis. It can be put into dals. Jaggery has a very good iron content. Jaggery can be used along with peanuts or groundnuts to make a chikki, which can be used in children with iron deficiency anemia. Apples and pomegranates are two fruits which have a very high iron content. Peaches and pears do have iron to a certain extent. Dry fruits such as dates and raisins should be given to the child who is suffering from anemia, as the iron content in them is also very high.